Mario, thank you so much indeed for joining us. How has Europe come to this stage? We knew it was going to happen. They told us when we were in the middle of what was happening in the European spring that this thing was going to come back, and here it is. Were we unprepared?
Well, first of all, good morning, and thanks for having me. Well, I'm not an epidemiologist, but I can try to answer with my political scientist hat. It's partially true, I think, that some governments may have been better prepared than others. Yes, we knew it, and we have learned that already in other epidemics. But let me try to focus on three main kind of red threads that I'm seeing. I think the first is really a lack of policy coherence. Healthcare has never been so prominently high in national political landscapes, and the relationship of the scientific community with the politicians has been a little bit bumpier than we thought. Because on one side you have the imperatives of science, but then on the other side you have politicians who have to balance these imperatives with the sentiment of society and the marketplace. So that's a tough conundrum where to be. The second thing is, the reopenings, this is a kind of an obvious reason, right? The reopenings, of course, were responsible for that. And there is also a little bit of fatigue. The lockdowns have caused massive disruption around the world, have destroyed jobs, have affected the people health, and taking children out of school. They were able to control the virus, but then lifting the restriction was a good thing to do in the summer and a needed thing to do. But the easing of the restrictions and coupled with the people dropping their guard, of course, has produced that situation. After the summer, people come back to the offices, come back to public places, are tired, and therefore that's part of the reason. The most important, and let me conclude on this, is on the communication. I really have seen in a lot of countries a massive difficulty in communicating with the general public by authorities. We have not been able to communicate what we do not know. And that is the main issue, I think. In many cases, authorities have not spoken with one voice. They've let the public take stock of conflict in views between scientists and politicians. And we know that poor health literacy is common. We know that there is a paucity of scientific knowledge about the virus, but yet we have put people in a limbo, exposed to amplification of information that they were unverified, misunderstanding, fear, loss of trust. So we need a new playbook. And if we have learned something from the second wave so far, is that we have not done a good job in communication, and we have to do that better now, actually, starting from now.
From the point of view of health and medicine, what do you make of the strategy which is being employed across most of the European lockdowns of keeping schools open? Is that going to make the lockdown far, far less effective?
This is $1 million question, and it's again the intersection between, what I was telling you before, science and politics. I will try to echo some, what we heard from many authoritative sources like, Dr. Fauci in the US. The schools are really important for the psychological welfare of the children, given the fact that so many children rely on schools for so many things, not to mention the impact on working parents who are often in difficulty due to reduced income because of the lockdowns. There is no one size fits all. We must be flexible, open-minded, depending upon the level of infection where the schools are located. And that, in my view, is one of the key priorities for local governments, figuring out exactly that balance. Education is a fundamental enabler of human development. We cannot afford to actually penalize the next generation for our inability to prioritize, because we just don't know how long this is going to carry on.
Mario, obviously, if someone has COVID, their primary concern is that they will simply survive it, that they will live through it. But there is this other issue, which is building, and the evidence is quite shocking. And they're calling it long COVID. There was one study which showed amongst certain patients with COVID-19 of a certain age that it might indeed accelerate their chances of getting Parkinson's. There's this thing called the COVID brain fog, that people literally for months afterwards cannot basically do simple maths that they could do quite easily before. How it affects the heart in the long term. How worried are you about the impact on healthcare systems because of the secondary effects of COVID-19?
I am worried, and that's my personal view, but this is one of the most underestimated aspects in the public debate, and understandably so, because we've got a crisis to fix. As you say, impact on mental health, neurological health, and also on other parts of the body are starting to pop up, as of course we are deep into the pandemic. I think research will be key to assess what kind of services we need to strengthen as we learn more about the impact of the virus. Maybe a positive note, we have a challenge, but there are also quite good opportunities to grab. We will need to work out on keeping those health budgets very well funded. We know that now. There is a need to strengthen supply chains because there is a need to ensure continuity of services for infectious and non-communicable diseases. Because let's not forget, people also get sick for other things. And there is an opportunity to boost digital health services, telemedicine, remote care, but also to stimulate innovation. So I guess it's great to mention that, Adnan, because I think that is a theme that actually needs to come a little bit more forth, let's say, in the next weeks.
Mario, thank you so much. Always instructive to hear your analysis. Mario Ottiglio speaking from Geneva.